Furosemide is a diuretic used to treat fluid retention. Before administration, check blood pressure and potassium levels due to risks of hypotension and hypokalemia. Be cautious of ototoxicity, especially with IV push. Digoxin is used for heart conditions. Hold the dose if heart rate is below 60. Low potassium increases toxicity risk. Always check the apical pulse for 1 minute before giving. Lisinopril is an ACE inhibitor for hypertension. Common side effects include dry cough, hyperkalemia, and angioedema. Regularly monitor blood pressure and potassium levels. Metoprolol is a beta blocker used for heart issues. Hold if heart rate is below 60 or systolic blood pressure is under 100. It can mask hypoglycemia symptoms in diabetics. Regular insulin is a short-acting insulin. Administer 30 minutes before meals. It peaks in 2 to 4 hours. Be vigilant for hypoglycemia as a potential risk. NPH insulin is intermediate acting, peaking between 4 to 12 hours. Hypoglycemia is a risk. Remember to roll the vial gently before use, not shake. Warfarin is an anticoagulant. Monitor INR levels, aiming for a range of 2 to 3. Avoid foods high in vitamin K. Note that it takes several days to become effective. Heparin is an anticoagulant. Monitor APTT levels with a goal of 60 to 80. Protamine sulfate is the antidote. Be alert for signs of heparin-induced thrombocytopenia, HIT. Enoxaparin is a low molecular weight heparin. Administer subcutaneously in the abdomen. No lab monitoring is required, but watch for signs of bleeding. Levothyroxine is used for hypothyroidism. Take it on an empty stomach in the morning. Overdose signs include weight loss and tachycardia. Prednisone is a corticosteroid. Long-term use can lead to hyperglycemia, osteoporosis, and increased infection risk. Taper the dose slowly to avoid withdrawal. Albuterol is a fast-acting bronchodilator. Common side effects are tremor and tachycardia. Use it before administering steroids for optimal effect. Atorvastatin is used to lower cholesterol. Monitor liver enzymes regularly. Be aware of muscle pain or rhabdomyolysis as potential side effects. Nitroglycerin is used for angina relief. Administer 1 tablet every 5 minutes, up to 3 times. If there's no relief, call 911. Watch for hypotension. Hydrochlorothiazide, HCTZ, is a thiazide diuretic. It can cause hypokalemia. It increases urination and helps lower blood pressure. Omeprazole is a proton pump inhibitor. Long-term use may lead to low magnesium, osteoporosis, and C. difficile infection. Monitor these risks. Vancomycin is an antibiotic. Monitor trough levels to ensure efficacy. Administer IV slowly to prevent red man syndrome. Ceftriaxone is a cephalosporin antibiotic. Check for penicillin allergy due to the risk of cross-reactivity. Morphine is an opioid analgesic. Monitor respiratory rate closely. Risks include respiratory depression, constipation, and meiosis. Naloxone is an opioid antidote. It reverses respiratory depression but may cause withdrawal symptoms. Use cautiously.